Hello, everyone. Welcome to US Healthcare Academy. I hope you all are doing well. So, today I'm going to introduce you to US Healthcare. So, what we are going to do is we are going to go through some basic terminologies in US Healthcare. And once you know about basic terminologies in US Healthcare, you'll be better able to understand and communicate well in the US healthcare space. So let's get started. So payer. So what is a payer? So payer is nothing but it's a fancy name given to the insurance company or government program like Medicare or Medicaid. So basically payer is anybody who pays for the healthcare services that you have received. So again, nothing but an insurance company. Provider. A provider is anyone who provides you the healthcare services. So it can be an individual, like an individual doctor, it can be a hospital, or it can be a nurse practitioner. So remember, provider is anyone who provides healthcare services, and in some cases, or not in some cases, but also a durable medical equipment supplier is also considered as a provider. Okay, NPI. NPI stands for National Provider Identifier. It is nothing but it is a 10-digit unique number that is assigned to any healthcare provider. So basically, any healthcare provider like hospital, doctors, or nurses are not recognized by their name but are recognized or are identified by a 10-digit unique number. Okay, like every individual in US has a SSN. That's a unique number that is assigned to an every US citizen. In the same way, in US healthcare setting, national provider identifier is like an SSN, not really an SSN, I'm just giving you an example, but it's like a unique number with the help of which you can identify any hospital, any provider, any nurse practitioner. Moving to the next slide. Provider types. So we have seen what a provider is. Now, provider types. Primary care physician. Primary care physician is nothing but is just like a person that you go to or doctor that you go to for your small problems, and you can call them your family doctors or internists. Specialist. So specialist is obviously someone you go to or you are referred to by your primary care physician for for a special. I mean, they have expertise uh, in the specific area of medicine. Example, person who has expertise with heart problems is called as cardiologist, with skin problems, dermatologist, brain issues, neurologist. So that's a specialist. Hospital, I'm sure everybody knows what a hospital is. Hospital is a facility where patients receive inpatient care, surgeries, and emergency services. That is true, but hospital also provides outpatient services. So, but yeah, mostly a person goes to the hospital, uh, for the inpatient care. I'll tell you what an inpatient and outpatient care is. That definition is coming in in the slides ahead. Subscriber. So a subscriber is the individual who holds the insurance policy and is responsible for paying the insurance premiums. This person may also be the primary insured on the policy. So let me tell you in very simple words what a subscriber is. So suppose you join an organization, and that organization provides you insurance plan. Okay, so when you join the organization and the insurance plan is provided to you, so you are the primary insured on the policy. Okay, but your organization or the plan that you are subscribing, it allows you to add your spouse and children as well. So your spouse and children, they will be dependent or members of the policy, but you are the subscriber of the policy because you're the main policy holder. Let's move ahead. Subscriber ID, nothing but a unique ID that is assigned to a subscriber, which uniquely identifies a subscriber, is the subscriber ID. So suppose you take an insurance, or you take insurance of BCBS, which is Blue Cross Blue Shield. They will assign you a unique ID, uh, that you will be identified with. So guys, as we are going through this concepts of subscriber ID and NPI, let me tell you one thing. In US healthcare is, it is standardized, and it has basically this identifiers for each and every entity. Like a subscriber will have a subscriber ID, a provider will have an NPI, a payer will have a payer ID. So just remember this concept as a high level concept, that in US healthcare you won't be identified by your name. You will be identified by an ID. You're a provider, you will have a provider ID. You're a subscriber, you'll have a subscriber ID. You're a member, you will have a member ID. Even payers have payer ID. So yeah, just keep this in mind. Member. A member is an individual covered under a health insurance plan. So as I told you before, what is the difference between subscriber and member? So just going to reiterate, member is a dependent, or in your case you can consider your spouse or your children as members of the policy. So basically they can receive services as per the terms of the insurance policy. Healthcare facilities. So here, okay, I'm gonna tell you about few different healthcare facilities, and this not necessarily this covers everything, because I just wanted to stick to basics. And yeah, but just keep in mind there are more healthcare facilities than what I have showed here. But these are some three basic healthcare facilities, and I'll tell you the differences between them. So, clinic, a healthcare facility where patient can receive outpatient care, often for primary or specialty services. So, basically, a clinic is where you go with your small problems, and that problem can be resolved in a day, and you can be sent home within an hour, or maybe within few hours. But yeah, that's a clinic. And obviously a clinic can be run by a general physician, or can be a specialty clinic where you go for special problems like skin, hair. No, yeah. Urgent care center. Before going to urgent care center, I would like to cover emergency room, because urgent care center would make more sense after I tell you about emergency room. So, emergency room is a facility for life-threatening or severe medical emergencies. So, for an example, somebody, suffered a, a major heart stroke, and their vitals are continuously dropping, and are within, you know, are dropping to a danger zone where they can lose their life. In those cases, patient is rushed to the emergency room. Urgent care center. a facility for non-life-threatening emergencies that need immediate attention but are not severe enough for the ER. So I'm not a doctor, but just to give you an example, uh, maybe somebody suffers a minor attack, they experience pain, but till the time they reach the hospital, uh, their vitals are kind of okay, but they do require immediate attention. But yeah, uh, you know, that condition is not life-threatening. So in those cases, patient is seen in an urgent care center. Diagnosis. So diagnosis is nothing but the identification of a specific medical condition or disease. So to give you an example, I go to a doctor and doctor asks me about my symptoms and I tell him that, oh, I have pain in my joints and I have consistent high fever. So the doctor suspects that I have dengue or malaria, and then he goes ahead and orders a lab test for dengue. The test comes positive, so dengue is the diagnosis. So basically, whatever condition you have is called as diagnosis. Now, what is an ICD code? So as I told you, in US healthcare, everything is, or most of the things are standardized, and they have their own code set or they have their own identifiers. Now, in case of diagnosis, diagnosis has its own code set. While documenting the patient's condition, you won't document dengue, okay? You will document the ICD code that is assigned to that specific diagnosis. So remember this, ICD codes is a set of codes. The full form is International Classification of Disease, and it is a code set which has code for each and every condition. All right, let's move ahead. Procedure. So procedure is nothing but, once you're diagnosed with something, you need to be treated, right? So that treatment that is provided to you by the doctor is called as procedure. Not necessarily procedure has to be something fancy like a surgery, though surgery is a procedure, but I'm just telling you that not necessarily it has to be something fancy like a surgery. It can be simple hydrotherapy, you're kept on saline, I mean, that's a procedure. To give you an example, suppose I go to the doctor, I complain about, throat pain uh, and itching in the throat. The doctor sees me and he sees that my tonsils are infected and swollen. So infection of tonsils is the diagnosis. And doctor suggests me that, you know, he can give me medications, but it is better if I get them removed. And I agree to it. So the doctor will perform tonsillitis. That is removal of tonsils. That's a procedure. And okay, so let's move ahead. HCPCS and CPT. So as I told you that ICD codes are codes for diagnosis. It's a code set for diagnosis. In the similar way, HCPCS and CPTs, they are code set for procedures. So each and every procedure will have a HCPCS or CPT code. And these are 5-digit codes, numerical, whereas diagnoses are alphanumerical. And they are in pattern of 3, then a dot and 4. So 3 alphanumerical dot and then 4 alphanumericals. CPT is straight 5-digit numerical number. Okay. Okay. So HCPCS, the full form is Healthcare Common Procedural Coding System. CPT is Current Procedural Terminologies. Both code sets represent procedures. However, there is a minor difference between HCPCS and CPT. HCPCS is a broader umbrella. It covers all kind of codes, including the codes for medical supplies, for durable medical equipment supplies. I'll tell you what durable medical equipment is, but before that, I want you to concentrate on what the minor difference is between HCPCS and CPT. So yeah, as I told you, HCPCS is a broader umbrella, covers all kind of codes, whereas CPT codes focus primarily on physician and outpatient services. Okay, so any service that is provided by a physician or any outpatient service, those are covered into CPT, Common Procedural Terminology. Okay, let's move ahead. NDC code, similar to how an ICD is for diagnosis, CPT and HCPCS are for procedure. NDC code is called as National Drug Code. It's a unique numeric identifier for the drugs, including vaccines, medications, biologics, and NDC number is an 11 digit number. It's in a format of 542, and each and every set, like 5 represents, who's the packager, like who's the which company has manufactured that drug. Yeah. So similar to NDC code, RX norm codes are again for medicines, vaccine, drugs, and biologics. The only difference between the NDC code and RX norm code is that, as it says, RX norm code. RX norm means normalize. So because NDC is manufacturer specific, even that is a unique number, but that is manufacturer specific. The normalized form of that code is not manufacturer specific. It is specific to the content of the content that is there in the drug, the power of the drug, whether it's 20 mg, 50 mg, or whatever. So remember, one generic drug can have multiple NDC numbers depending on who has manufactured it, but an RX norm code is a normalized form of the NDC code, and there is only one code for one medicine, one drug. Okay, yeah, but again, depending on the strength of the medicine, like I told you, if it's 50 mg, 100 mg, the RX norm code would vary. So it is the combination of the drug plus the strength and also the form. Sorry, I forgot. I missed to mention that. But RX norm code depends on three things: the content, the strength of the drug, and the form of the drug. When I say form, is it an injection? Is it a tablet? The form basically. All right. I hope this is clear. If not, please drop a comment in the comment section and I would be happy to clarify. Alternatively, I am also going to leave my email address in the comment section so you guys can email me. If you have any questions, if you need any clarifications, I'll be glad to help you. Let's move ahead. Benefit. So basically, when you buy an insurance, there are specific healthcare services that are covered in your insurance, like office visits, like surgeries, hospital stays, prescription drugs, preventive care. So benefits is just another word for what is covered in your insurance plan. Premium. Premium, again, I think everybody knows what a premium is, but premium is the amount you pay for your health insurance plan. Typically in US, it's on a monthly basis. Deductible. Now, guys, these are three important terminologies: deductible, co-insurance, and copay. When I started in US healthcare, I was really confused about what this deductible is. But yeah, with time, I got a clear understanding about what deductible is, what co-insurance and copay is. So let me just share that with you, but with an example. So suppose uh, I buy an insurance plan from BCBS, and suppose there are different types of plan: Plan A, Plan B, Plan C, Plan D. Uh, let's say get $50 per month. And what is copay? So copay is something, it's a flat fee. So my insurance plan says that, hey, whenever you visit a doctor, you know, as an upfront payment, you have to pay flat $10. So that flat fee is called copay. Okay. Now, what is co-insurance? So my plan says that whenever you visit a doctor or you get admitted for any inpatient services, you are going to bear 15% of the total billed amount. If your bill is $1,000, you will have to bear $150 out of that $1,000. Now, deductible, a very interesting concept. When I buy a plan, my plan says that you have to spend $500 in a year on whatever healthcare services you receive. Only after that, the insurance will kick in and start paying for your healthcare services. So I'll give you an example. I go to a doctor, whatever treatment I receive, my bill is $250. Okay. Now, because the insurance says that even before the insurance kicks in and starts paying for your healthcare services, there is a certain amount, which is $500, that you have to pay out of your pocket. Only then the insurance will start paying. So this $250, though the claim will be sent to the insurance company, but they will pay $0 and I will have to pay the entire $250 as deductible. Next time I go to the doctor, or suppose I'm admitted for something, some treatment, now my bill is $500. Remember, I still need to pay $250 as deductible because my deductible is 500. And once I pay that 500, only then the insurance company will start paying for my healthcare services. So next time I go to the doctor, my bill is $500. The claim is sent to the insurance company. The insurance company says, okay, 250. Jayesh Chaudhary is going to pay 250, and we will cover remaining 250. Guys, so basically that is deductible. I hope I've made it clear for you. And even after this, if you have any questions, please reach out to me, put a comment, and I'll be glad to clarify that for you. All right, guys. Prescription, simple, a written order from a healthcare provider for medication. I think most of us would have gone to a doctor till now, and everybody knows what a prescription is. The only difference is that in US healthcare, And nowadays, there are no handwritten prescriptions. There is something called as e-prescription. So even pharmacies are identified by a unique identifier, and that's a pharmacy ID. So doctor can pull in any nearby pharmacy or the patient's preferred pharmacy and send an e-prescription to them. That's a digital prescription. So you don't really need to carry a handwritten prescription to the pharmacy and ask them for medications. So they know. Treatment plan. So treatment plan is nothing but a plan outlining the course of treatment for a patient's medical condition. So basically, as soon as you're admitted and doctor knows that okay, he's suffering from dengue. So in the EHR system, which is the electronic health record system, which is used by doctors and nurses, uh, they will put a treatment plan for you. So what they're going to do on day one, what kind of therapy they're going to give you, what medications do they need to give you, the timing of the medications and everything. So all that treatment plan is in the EHR. And then, because in US everything is streamlined and automated, especially in the healthcare sector. So nurses would get, uh, reminders that which patient in which room number needs, you know, is due for what therapy or what medication, and it happens on time. Bingo. All right, medical history. Quite self-explanatory. It is all your past illnesses, surgeries, and your family's medical background. That is your medical history. Electronic health records. Electronic health records is nothing but so basically EHRs are electronic health record systems, and when you visit a doctor, all your information is documented in EHR. So all your information is digital. There is no paperwork at all. Nothing is documented on paper. Okay. So right from when you enter the doctor's clinic, you're checked in. When you visit the doctor, your encounter, your chart is open, and a new chart basically. Uh, Whatever your symptoms are, those are documented, your diagnoses are documented, whatever procedure doctor is doing, that is documented, whatever medications he has prescribed you, that is documented, your social history is documented, whether you're a smoker, you have any kind of other addiction, alcoholism, even that is documented. Your vitals, like your blood pressure, your height, weight, BMI, systolic, diastolic blood pressure, that is documented. If the doctor needs to send an order, let's consider a lab order for your blood test, even that is done electronically, and even that is documented. So here they don't need to give you a chit and with their stamp and send you to a laboratory to get this test done. They will just order the test electronically. The lab will automatically receive it in their system. They know where this test is coming from. They will send a person to collect the specimen, and then the test results are also sent electronically. So imagine, guys, this is high level of digitalization. I love it. So that's just in nutshell what an electronic health record system is and what electronic health records are. So your records are maintained in a system. They are digital records. They're not on paper. Nurse practitioner. Nurse practitioner is again nothing but what we call them as nurse with advanced training, able to diagnose and treat certain medical conditions. So in some conditions, with doctor just supervising, even nurse practitioner or a physician assistant can provide you or can treat you for certain medical conditions. Physician assistant is nothing but it's again a healthcare professional with training to provide medical care under the supervision of a physician. Physician assistant is also called as PA. Guys, just remember and make a note of this that a lot of times the shortcuts will be or the short forms will be used instead of the full forms like EHR, like NP. They won't say nurse practitioner, they will say NP, they'll say PA, physician assistant, interchangeably also called as mid-level provider, but that's another term, but mostly referred to as physician assistant. So basically, I complete my MBBS. I need to do internship somewhere under the supervision of a doctor. So that doctor is called as a supervising doctor, and I will be a physician assistant or rendering doctor who is actually rendering the services. So remember this term as well. Rendering provider is somebody who is actually treating the patient, whereas supervising provider is just watching him, supervising the treatment, making sure that it's happening correctly. We'll see these terms later. I mean, in next videos maybe. Okay, Medicare. So Medicare is a federal health insurance program for people aged 65 and older, and some younger individuals with disabilities. So Medicare is nothing but it's a government program, and it is given to people who are above 65 years of age, and in some cases to younger individuals with disabilities. Medicaid. Medicaid is a joint federal and state program that provides healthcare coverage to low income individuals and families. Quite self explanatory. Inpatient. So I think we have spoken about this before, but just to reiterate, inpatient care is when your issue or whatever you're facing, your problem cannot be resolved within a day or by visiting to your PCP or specialist in a clinic, and you have to get admitted, and that is called as an inpatient care. Outpatient, opposite to inpatient, you go to the doctor, you're suffering from cold, cough, he sees you, he gives you some medications, gives you an injection, sends you home. That's an outpatient care. Outpatient care is also given in the hospitals, mostly in clinics, but yeah, also in the hospitals. HIPAA. HIPAA is very, very important, guys. HIPAA is a federal law that protects the privacy and the security of an individual's health information. So they have some rules and restrictions in the place which are very, very important, and there are very strict actions and strict fines that are in place for somebody who breaches HIPAA. HIPAA altogether is another topic, and we'll have to make a separate video to cover entire HIPAA. But for now, just remember that if you're making career into US healthcare, and no matter what you're working on, may it be revenue cycle management or on the clinical side, or you're an EHR operator, or for that matter, you're working on payer side, doesn't matter what you're working on. If you're working in US healthcare space, you have to be HIPAA certified. You have to pass that training. So yes, don't worry. I'm just stressing because it is very important, and so that there is something called as HIPAA, Health Insurance Portability and Accountability Act. So we will have a session on this. We'll have entire video on this, and I'll make sure that you understand it very well. PHI. PHI is nothing but again one of the components of HIPAA. It is protected health information, which refers to individually identifiable health information related to an individual's medical history, treatment, or condition that is protected by healthcare privacy regulations like HIPAA. Okay, that was the definition. But let me give you an example. What is PHI? Now, the first line says PHI refers to individually identifiable health information. Individually identifiable health information means any of the identifiers that uniquely identify you or at least helps to identify you. Now, if you Google PII, which is personally identifiable health information, there are 18 such identifiers. Okay, some of them I'll state it here. One is first name, last name, middle name, SSN, MRN. MRN is medical record number. I'll tell you what that is. Your driver's license, your phone number, your license plate number. Okay, because okay, now this is PII, personally identifiable health information. Now, individuals' medical history, treatment, or condition. So that means what my illness is, that is my diagnosis information, my procedure information, like what I have been treated for or what treatment I have received, medications, my lab orders, my lab results, my social history, my plan of care, all of this comes under treatment, condition, medical history, etc. Now, PII and this combined together is a very dangerous combination because on a piece of paper, I have written uh, I've written diagnosis information. I have written procedure information, medication information, all the information. But until and unless there is no PII on it, that information is useless because that doesn't show that uh, who that information belongs to, right? But suppose with all that I have an SSN written on it. Boom, that's a bomb. That is dangerous. That's a nuclear bomb because now you have disclosed somebody's health information which you're not supposed to do. Anybody can have access to that paper. That's a very small example of how, what are the rules and restrictions, what HIPAA is, what PHI is. But guys, stay tuned. We are going to cover this in detail. All right, let's move ahead. Prior authorization. Prior authorization is a requirement by an insurance company for a healthcare provider. So, clinics, doctors, hospitals, to obtain approval before certain medical services or medications are covered. Let me give you an example. Now, as the name or the term suggests, prior, before, authorization, you know, it has to be, yeah, you have to provide an authorization. So let's take an example, guys. Maybe that will be simpler. So, you know, I go to a doctor, I have diabetes, and I'm taking one insulin shot per day. Now, okay, doctor asks me that, are you eating properly? Yes, I'm following everything that you've advised. I'm taking one insulin shot on regular basis. Doctor sees my blood sugar level is still spiking. So doctor thinks that I would require two insulin shots. But hey, wait. Insurance companies have this restriction on specific procedures or specific medical services. You cannot take the decision no matter what. No matter you think that 100% this patient requires two insulin shots, but no, you can't take that decision. You have to send a prior authorization request to the insurance company. Okay, you have to give them justification why this patient requires two insulin shots. They will provide an approval or they will deny it. Okay. Now, in this case, it's valid because yes, this patient is doing everything that he needs to do. He's taking his medications on time. He's following all the diet that is given by the doctor, but still his blood sugar level is not in the normal range. So this patient requires two insulin shots. That prior authorization will be approved by the insurance company. Provider will receive the authorization. There will be a prior auth number on it, you know. So that is again a unique number for that prior authorization. As I told you before, guys, everything, mostly everything has a unique identifier. So hope prior authorization is clear in your mind now. Let's move ahead. Explanation of benefits. So explanation of benefits is, again, I'll have to tell you a story. So once you receive all your healthcare services, you are admitted, now you're discharged, you haven't paid anything, right? Or maybe you have paid a copay, upfront fees or something, but yeah, most of the amount is still pending. So the healthcare providers, maybe the hospital, they need to get reimbursed, right, for the healthcare services that they have provided you. So what they'll do is they will send a claim to the insurance company, okay, with all the information, with your name, your subscriber ID, uh, what conditions have been diagnosed, what procedures have been performed each day, uh, what medications you have been given, everything. And then the insurance company sees that claim and they approve it. Okay, fine, and they are going to pay the provider. So when they pay, they give an explanation of how the claim was adjudicated. What is the breakup? And I will show you that breakup in the next slide. This is an example of the explanation of benefit. So basically, it has patient's name, address, it has the claim number. Claim number is again a unique number that is assigned to each and every claim that is sent to the insurance company. It has providers information, it has member ID, group name. Okay, now this is the important part. Pay attention here. Date of service. So this is when you received that service. There's also a procedure code, actually, the service that you have received, which they haven't put it here, but that's fine. Just remember that there is also the service that you have received. Give me 1 minute. There's a date of service here for that specific procedure code or for that specific service. What is the total charge amount that is here? So let's take examples, okay? So suppose this is $100. This is $100. Other insurance. So basically, suppose this is an explanation of benefit from the secondary insurance. So sometimes you do have two insurances, right? Primary, secondary, or you can have tertiary as well. You can have other insurance as well. But in most conditions, primary and secondary. So if this is an explanation of benefit from secondary, here they will mention what primary has paid. Okay, but in case of, if this explanation of benefit is from primary, this is nothing, zero zero. Amount paid by this insurance company. Let's suppose $50 here and $50 here. Total $100 here. Total charges here is $200. Now we're coming to a very important section. This all together is called as patient responsibility. Patient responsibility is nothing but co-insurance, co-pay, deductible. We discussed this before, right? This is something that patient has to pay from their pocket. It's also known as out-of-pocket expenses. So along with co-pay, co-insurance, and deductible, there is something called as non-covered charges, which is also patient's responsibility. My insurance doesn't cover a root canal, but I have sent a procedure for root canal. They will mention it here that this, okay, suppose this is root canal, $100. Other insurance, $0. Amount paid, $0. Non-covered charges, $100, because this is a non-covered service. We don't pay for root canal procedure. Okay, and then the total patient responsibility. So suppose root canal, total patient responsibility becomes your $100. This is another procedure. Okay, so this is covered. Whatever the deductible is, if you have already paid your deductible, then nothing here. If you have not, if there is some deductible pending, then this that some amount will be here out of the total amount. Co-insurance is obviously the percentage of the procedure. So whatever the co-insurance is will be here. Co-pay is your $10 flat that you have to pay. That will be here, and this will be the patient responsibility and the total patient responsibility. So that is a short explanation of what explanation of benefit is. This is a paper version, but guys, remember this is just for your explanation. But nowadays there are no paper versions. Everything is digital, everything is sent electronically, and same is with claim and explanation of benefit. But those are a subject, those are expertise in themselves. Like, there are people who are expert in claims, like 837 formats. There are people who are experts in 835, which is remittance. So those are vast topics, and I am really excited to jump in there. But before I really go ahead and jump in there and start, you know go into details, I really want you all to be comfortable with what basics are, what basic terminologies are, what are different types of systems like EHR, RCM, what is clinical data, how a patient's charge is entered into an RCM system, how it flows through. So yes, we have a lot of grounds to cover before we really dive in details, but that's going to come, guys. All right, guys. So I hope everybody understands what a explanation of benefit is. Let's move ahead and let's jump into enrollment. Enrollment is nothing but registering for a health insurance plan to gain coverage for medical expenses. So in some cases, suppose if you go ahead and buy your own insurance, you're not employed, you're self-employed, and you want to choose your own insurance, you buy an insurance. The procedure of registering you in the system, entering your information, entering your family's information, whoever is covered, assigning a plan to you, yeah, assigning subscriber IDs, member IDs. So all that information is entered in the system. That is enrollment. Okay, but enrollment also has another part to it. Now let's take an example where you are employed. Okay, so you join a new organization, and your HR takes all your information, your dependents information, uh, and I'll not talk about how it works in India, but let's talk about how it works in US. So that information is electronically sent to the insurance company. They then register you in the system, assign you to a plan, and now you are officially a member and subscriber of that insurance plan. That procedure is called enrollment. Enrollment again is an area of expertise in world of EDI, electronic data interchange. The format that enrollment is sent is 834. Don't wrap your brain around it right now because we're just going through basics. I'm just, you know, introducing you to electronic data interchange as I go, because I think somewhere in future when we do our future videos, it's going to be important. Uh, all right. Claim. We have already spoken about what a claim is, so let's not repeat that. But EDI format of claim is 837. These are just three digits number that assigned to the electronic data interchange formats for each and every area of the US healthcare, like claim, remittance. Remittance is explanation of benefits. Remittance like 835, enrollment 834. Okay, let's move ahead. This is how a claim form looks like. I don't intend to take you through this claim form, but just remember this is a CMS 1500 form which is used for outpatient services. This is called as professional claim. For institutional claim, there is a separate UBO4 form which is called as uniform billing form. And it has more fields than what this form has. This form has 33, I think. Yeah. Okay. There will be another video to discuss on this form, to go through each and every field and to discuss what information goes in what field. Okay. So there's going to be another video on this, guys. For now, just have a look at the form. If you want to Google it, just type in CMS 1500 form and try playing around with it, see what all it has. And if you understand by the terminologies that we have learned right now, how many do you find it here? Yeah, that will be a good exercise to do, so that you know you know what all information you can recognize on this form. Out of pocket costs, we have already spoken about this. These are again nothing but co-insurance, copay, deductible, and non-covered services. Okay, those all together is out of pocket cost. Home health care. Home health care is for people who are disabled or who are not in a condition to visit or travel to a hospital or to a clinician. For them, there are home health care services. Okay. All right, guys. So with this, we come to the end of this video. Let me know, guys, if you have any questions, any feedback about this video, and I'll definitely try to implement that and make this better for you guys, because ultimately what matters to me is your learning. Okay, if you're able to get what I'm trying to coach you on. All right, guys, next video will be coming soon. Stay tuned for that. That will again be an introductory video. I see you next time. Have a good day. Bye bye.